Are you struggling with high eye pressure, glaucoma, or even thinning eyelashes? Well, there's one eye drop that has made a big impact in both the medical and cosmetic world. Bimatoprost Eye Drops. But how safe is it? How does it actually work? And why is it so widely prescribed in countries like the USA, UK, Canada, and across Europe? Stick with me, because in this video, we'll cover everything you need to know about Bimatoprost, from how it works, to its medical uses, cosmetic benefits, side effects, and important precautions. By the end, you'll have a clear and reliable understanding of this powerful eye drop. First, start with what is Bimatoprost. Bimatoprost is a prescription medication that belongs to a group of medicines called prostaglandin analogues. It was first created to treat glaucoma and ocular hypertension, but doctors quickly noticed an interesting side effect: longer, thicker eyelashes. Today, it's available under different brand names. For example, Lumigan is used for eye conditions, while Latisse is marketed for cosmetic eyelash growth in the United States. Now let's see how does it actually works. In glaucoma and ocular hypertension, pressure inside the eye becomes too high because fluid doesn't drain properly. Bimatoprost works by increasing the natural outflow of fluid from the eye, which lowers eye pressure and protects the optic nerve from damage. And when it's applied carefully to the lash line, it stimulates the growth phase of hair follicles, making eyelashes appear longer, fuller, and darker. Now let's go over the main uses of Bimatoprost. First, glaucoma, especially open-angle glaucoma. This is the most common type of glaucoma worldwide. If untreated, it can cause permanent vision loss. Bimatoprost lowers eye pressure by about 25 to 35%, and that's why eye specialists often recommend it as a first-line treatment. Second, ocular hypertension. This means your eye pressure is high, but there's no optic nerve damage yet. Since untreated ocular hypertension can turn into glaucoma, doctors use Bimatoprost to prevent future problems. Third, some types of secondary glaucoma. In certain conditions like pseudoexfoliative or pigmentary glaucoma, Bimatoprost is sometimes prescribed to keep eye pressure under control. Fourth, cosmetic eyelash growth. This is where the brand Latisse comes in. The FDA approved it back in 2008 for people with thin or sparse eyelashes. After about 16 weeks of regular use, lashes can become up to 25% longer, more than twice as thick, and noticeably darker. And finally, off-label uses. Some dermatologists may use it for eyebrow growth or even for certain types of hair thinning. There's ongoing research into its role in helping people regrow lashes and brows after chemotherapy. Here's how it's usually used. For glaucoma or ocular hypertension, 1 drop in the affected eye, once daily in the evening. Remember, don't let the bottle tip touch your eye. For eyelash growth, apply it with a sterile applicator to the upper lash line only, once per night. Don't apply it to the lower lashes and wipe away any excess liquid to avoid unwanted hair growth. Most people start to notice results within 8 to 12 weeks, and the full effect is seen around 16 weeks. And here's an important tip. Using more drops will not make results faster. It only increases the risk of side effects. Like all medicines, Bimatoprost can cause some side effects. The most common include red or irritated eyes, itchy or dry eyes, darkening of the eyelid skin. And of course, increased eyelash growth, even in places where the liquid touches accidentally. Less common, but more serious side effects may include permanent darkening of the iris, especially in people with blue, green, or hazel eyes, vision changes or severe eye pain, or signs of an infection. If you notice anything unusual, you should contact your doctor right away. Here are a few safety points to remember. If you wear contact lenses, take them out before applying the drops and wait at least 15 minutes before putting them back in. If you're pregnant or breastfeeding, use only if your doctor recommends it. Avoid using it if you have an active eye infection or have recently had eye surgery unless your specialist says otherwise. Always wash your hands before use and never let the bottle tip touch your eye or lashes. In most countries, including the USA, UK, Canada, and Europe, Bimatoprost is only available with a doctor's prescription. It's also important to use it consistently. Missing doses makes it less effective. And if you stop using it, your eye pressure may rise again, or your eyelashes may gradually return to how they were before. So, whether it's preserving vision in glaucoma, preventing complications from high eye pressure, or enhancing eyelashes for cosmetic reasons, Bimatoprost eye drops have become a trusted option around the world. Now I'd love to hear from you. Would you personally use Bimatoprost more for medical treatment, or for cosmetic eyelash growth? Share your answer in the comments below. And if you found this video helpful, don't forget to hit the like button, Subscribe for more detailed health insights and share this video with friends or family who might benefit. Thanks for watching, and remember, your eyes deserve the best care.